Hello, and welcome to The Real USA. Today, we're at Washington, D.C.'s Union Station, the heartbeat of transportation in, out, and around the nation's capital. With 32 million visitors per year, it's one of the busiest train stations in the country. On today's program, you'll hear stories on education, healthcare, immigrant and workers' rights, all from the United States in a way that only Telesur could do. I'm Alexandra Hall. Let's see what we have for today. A recent study finds that hospitals in Colorado aren't staffed with enough doctors to treat the population. Before, this was a problem more common in rural communities. Now, it's starting to affect big cities. Mary MacCarthy has the report.
Private practice here in the suburbs of Denver keeps him busy.
When I get sick, I really get sick.
But several times a month, he also travels to small towns in Colorado that don't have a resident physician.
The demand that's there is outstanding. It's remarkable to see how many people actually need care.
And it's not just rural areas in Colorado that don't have enough doctors. Several densely populated counties are also affected.
We see it every day. The urban clinics and even some of the suburban clinics really have a lack of providers, whether or not it's PCPs or then the specialists to help.
Experts attribute the problem in part to the fact that Colorado doesn't have many doctor training programs or residencies.
Physicians tend to practice close to where they either live or where they trained. So there's definitely interest right now at thinking through whether or not we have enough residency programs in areas where we want doctors to eventually locate in the future.
State and federal officials recently partnered to create a program addressing the issue by offering to forgive medical school loans for graduates who opt to work in areas where there's an acute doctor shortage. Here in Colorado and in many places around the U.S., the challenge is not just finding a doctor, but finding a doctor who will accept your specific health insurance. Physicians have the right to pick and choose which patients to see and which ones to refuse.
So there may be providers who are available to see someone in a community, either in a rural setting or an urban setting, but because they don't take that insurance, that then prevents them from having the access that they need. It's a struggle for a lot of people.
Many doctors say they just can't afford to see patients on Medicaid, the government-run health insurance program for poor people.
In an ever-increasing competitive environment, it becomes a process of making sure that their patient base is one that can support the practice.
Recent data shows that low-income Coloradans have the worst access to doctors and often simply have to go to the hospital when their needs become urgent.
Last resort is to then go to the emergency room for primary care, which is what none of us want to see because we feel like that's more expensive care and less appropriate care for patients.
Many regions are simply learning to function with fewer doctors and depending more on support staff.
There's a lot of questions about whether or not team-based care that really relies more heavily on sort of the nurse practitioners and physician assistant models and even care navigators, whether or not that adds capacity to the system that then sort of frees up physicians and others to really focus on people that need sort of the acute care or have chronic ongoing conditions.
Colorado has been changing its laws to allow nurses to take on greater responsibilities in areas where there just aren't enough doctors to go around. Mary MacCarthy for Telesur, Denver.
Let's keep going with healthcare. Hospitals and doctors' offices in Colorado were hit hard by the financial crisis, and some are still recovering, especially in small towns. Steve Mort has the story.
At the Spanish Peaks Regional Health Center in rural Colorado, making medicine pay is a daily battle.
We just don't have a big profit center when you're in a rural area.
Todd Oberhue runs this hospital in the small town of Walsenburg. Like many remote communities, Walsenburg's population of just 3,000 is aging rapidly and is relatively poor. A large proportion of its population needs government help to pay for health care. Recent cuts in public spending means reimbursements to hospitals like this are falling, leaving towns like Walsenburg in danger of losing their medical facilities.
It's putting a lot of pressure on them to try to find a way to keep their hospital in their community.
Many people in rural areas lack private health insurance and can't pay for their treatment. High rates of obesity and diabetes put additional pressure on hospital budgets. It all means rural hospitals don't have sufficient money to attract enough medical staff. While Walsenburg is fortunate to have a well-equipped medical facility, many communities like this one across the United States aren't so lucky, with some people having to travel hundreds of miles just to get the critical medical care they need. The cost crunch means many rural hospitals face closure, in turn putting lives at risk, according to experts. A study by Colorado investigative news organization iNews shows the majority of U.S. traffic fatalities happen on rural roads, even though only 20% of Americans live in rural areas.
The more rural you are, the more remote you are, the more far away that this injury occurs from definitive care, the higher your mortality rate is.
Small populations mean ambulance services are also lacking in rural areas, often further delaying emergency care.
Ambulance services get paid for transporting people. So when that type of reimbursement model exists, obviously the encouragement is for people to be transported. And in communities where there are fewer and fewer transports, the smaller and smaller the resources exist within that community to provide that public service.
Meanwhile, the long-term fate of rural hospitals could be tied to the implementation of President Obama's healthcare reforms. Opponents of so-called Obamacare say cuts in government assistance will hurt rural facilities, while supporters say by ensuring more people, the financial future of small hospitals will be more secure. Steve Mort for Telesur, Walsenburg, Colorado.
The California Supreme Court recently decided that undocumented immigrants are allowed to practice law. The decision was based on the case of one man, Sergio Garcia, a Mexican immigrant who passed the bar exam on his first try, but still didn't have a green card.
Sergio Garcia has two dreams: to practice law and to live in the United States as an American citizen. Until the recent California Supreme Court ruling, only U.S. citizens were allowed to obtain law licenses. Garcia fought hard to change that. First, he tried to become a legal citizen.
I applied to adjust my status on November 18, 1994. By January 15, 1995, I had my application approved, meaning that there will be a visa for me to achieve legal residency here at some point. Unfortunately, I've been waiting for over 18 years now and still no resolution.
When I spoke with Garcia last year, he explained how he wasn't willing to wait for citizenship to follow his dream of becoming an attorney.
Garcia earned his law degree and then took the state bar exam, a difficult 3-day test that quizzes applicants on their legal knowledge and morals. It's illegal to practice law without passing the state bar exam. Although Garcia passed on the very first try, he was denied a state-issued license because the test specifically asked whether applicants were legal residents of the U.S.
California state bar officials later said they regretted including that question on the exam.
It was put on the application simply as an investigative tool, period, end of story. No politics, no philosophy involved in the decision at that time.
It did become political. Garcia was banned from practicing law, and he saw his dream become a debate centered around immigration. KRISTEN Williamson with the Federation for American Immigration Reform said Garcia should not be allowed to practice law, in part because he was breaking the law.
The state bar advocating for illegal aliens to be admitted really dilutes the credibility of those law licenses.
Garcia was undaunted. He told his story to anyone who would listen and eventually got the support he needed from the state legislature and the governor of California, who signed a law authorizing the use of a law license by an undocumented immigrant. It's legislation that had to be passed in order for the California Supreme Court to consider ruling in his favor. The court did, and it was a complete surprise to Garcia. He spoke by phone after the ruling was decided.
I feel vindicated to some extent, but I really don't think anybody should have to waste 4 or 5 years of their life to be able to, do what they should have been able to do from the get-go.
Garcia's landmark case means other undocumented immigrants won't have to wait. They can practice law in California if they, too, pass the bar. Lindsay Mastis for Telesur, Los Angeles.
A few months ago, a teacher in Colorado made headlines when she quit her job and her resignation letter went viral. In it, she said that teachers aren't paid fair salaries and that programs that prioritize standardized testing have ruined public education in the United States. It's a criticism heard from educators all around the country.
It's breaking my heart. I can't. I really honestly don't know what I'm going to do if I'm not teaching.
After 11 years in the classroom, Pauline Hawkins has decided to quit a job she loves. Her primary reason is that she's not paid enough for a basic middle-class lifestyle.
If you really want to get and keep quality teachers, you have to increase pay. We cannot survive as teachers here in Colorado.
Pauline didn't go quietly. Rather, she published her resignation letter nationally on the popular website Huffington Post.
This is not okay what you're doing to teachers.
She called the move a form of protest and a way of standing up for fellow teachers.
To show us that you appreciate us and respect us, and the only way that you can actually do that is by increasing the pay. I can't even tell you how many times a parent or even a student has said to me, I pay your salary, you know, and the fact that they think that they can say that to us, it is so disrespectful.
According to most studies, Colorado teachers rank in the bottom half nationally when it comes to pay. With a master's degree and over a decade of experience in the classroom, Pauline Hawkins says she brings home less than $34,000 annually, and that doesn't include health care.
When I was paying family health insurance, it was $800 a month.
Pauline says the only financial advantage of teaching is that it gives access to a public pension system that historically has been generous.
That was probably the only reason that would have kept me here, is that retirement. But at the end of the day, I was like, no, it's just not worth it.
Education professors say they warn future teachers that if they're looking to make decent money, they should choose another profession.
There are no surprises when it comes to, I would say, for salary. Most of the candidates I work with recognize that there are other qualities to teaching, particularly their sort of sense of calling to the profession, and understand that there is a pay differential between what they do and comparable professionals in other arenas.
Teacher pay is a debate that unites people across the political spectrum. Even conservative analysts say the system needs to be reformed.
And what we have now is a system that's backloaded. So a teacher who wants to make that substantial living has to work through the system for 30 years and then gets the pot of the gold at the end of the rainbow, which is the pension system. But the pension system we have is not a sustainable one. And to make that work, we have to limit the opportunities available to newer teachers as far as salaries and other benefits and performance pay opportunities.
And the structural problems go even deeper.
The predominant pay model in education, and it's still in Colorado for most places, is one that was created in the early to mid-20th century for a time when most teachers were expected to be not the main breadwinner in the home, were often women who had another income coming to support them. But that's not really reflective necessarily of the teaching workforce we have today. And if we want to bring the best and brightest into the profession, keep them, we need to reward them and give them opportunities to make more salaries earlier in their career.
Perhaps those reforms will happen, but for veteran teachers like Pauline Hawkins, it's too late.
The number of people in the United States who struggle to make ends meet living on a minimum wage keeps growing. And with it, the gap between who's wealthy and who's poor gets bigger. Our next story comes from William Denslow in New York.
Being a single mother is no easy task, especially when you're raising 4 boys alone on the minimum wage in New York's public housing system.
The minimum, one always need the minimum.
For Santos, paying the bills is a constant worry. She's worked several different jobs, but is barely keeping up with the $660 rent each month. With concerns over the mold in the bathroom and 4 growing boys living in a single room, she wants a bigger place. And that means making more money. Already relying on food pantries to help feed her kids, she says the minimum wage of $8 an hour is too low. To raise more cash, she's planning on taking a second job.
As a mother, I want to give the best for my kids. But I'm waiting to move to a transfer. But there, I would have to pay more. But as my children grow up, they will need more space.
Staff at LSA Family Health Service say numbers of people relying on their food pantry keeps rising. Employment is now at higher levels than before the recession, but with many of these being minimum wage jobs, people here aren't surprised numbers aren't dropping.
Right now, the minimum wage is, you can still be making at poverty level and be making minimum wage if you have a family, so that's obscene.
Minimum wage is a factor, but James Parrott at the Fiscal Policy Institute says a growing income polarization over the last 3 decades is a major reason for New York's high poverty levels. More of New York's poor may be finding work, but as the economy begins to improve, he says these gains are mostly going to the richest people.
The people in the middle and at the bottom are not seeing income gains that allow them to sustain the consumption that they need. So we've seen an increase in poverty levels. In New York City, we've seen a disturbing increase in homelessness.
In the last 3 years, Parrott says 95% of income growth has gone to the wealthiest 1%. Jobs may be up, but so are the number of people living in shelters.
It's nothing short of a tragedy for those families that are trying to exist in a shelter. It's particularly hard on the children.
The juices too, the cans.
Shelters and food pantries are vital for New York's poorest, but many feel firm government action is needed to effectively shelve poverty. That action is proving hard to come by, though. A recent bid to try and raise the federal minimum wage was blocked by Senate Republicans, a move that advocates for raising the minimum wage say denies a raise to 28 million hard-working Americans. William Denslow, Telesur, New York.
Well, that concludes today's The Real USA. Don't forget, you can always send us your suggestions and feedback to our Twitter at @TelesurEnglish. I'm Alexandra Hall. See you next time.